Hi, this is Eric McGovern, and I'm doing joint mobs, the tibiofemoral, metacarpal, phalangeal, and glenohumeral joint. Before I apply the Maitland grades 1 through 4 joint mobs, I'm going to review what happens in each grade. Grade 1 is a small amplitude mobilization at the beginning of the range. So I put my thumbs on the tibial plateau and the rest of my hand behind the back of the knee. And I'm going to just nudge forward a little quickly and gently. And this is mainly used for pain reduction. Grade 2 is also primarily for pain reduction. It's a high amplitude mobilization that starts at the beginning of the range. So I'm going to go to the beginning of the range and do more high amplitude mobilizations. And so grade 3 is a high amplitude mobilization that is moved all the way to the joint limitation. So I'm going to go to the limit, posterior and anteriorly. I'm not going to exceed the limit. This is used to maintain range of motion. Technique 4 is small amplitude technique that begins at the joint's end range. So I'm going to pull and distract towards the end range, and then do small amplitude mobs. And since it's past the limitation, it increases range of motion. The grade 5 we're not going to do, but it's also for increase in range of motion. That will be excluded from the video. Relatively, force has much difference between the tibiofemoral and metacarpal phalangeal joints because there's less structure such as muscles, tendons, and ligaments holding the fingers in place. Now I'm going to glide the finger. That's really little resistance. I can glide it anywhere I want with ease. And that's the main difference between the tibiofemoral and metacarpal phalangeal joint. For the glenohumeral, could you lay down with your head over here? I'm going to do an inferior glide. So, yeah. Alright. So I got her arm tucked up under mine. Hand on top, right here, above her shoulder, and one down here for stability. I'm performing the inferior glide on the joint. This helps enhance lateral shoulder abduction, and the resistance begins about mid to end range, and it increases as I get closer to reaching end range. The glenohumeral joint compared to the previous joints, the tibiofemoral and metacarpal phalangeal, shows increased laxity and mobility because of the more mobility equals less stabilization. And that is joint mobs for those 3 joints.